Hello, class. So we're back in Combat Medics, and this time we're doing the scholarly survey and using the American History and Life Full Text Database. So in this, my research and then going through this, 11 hits for Combat Medics, two of which I've already used and already have discussed. Um, all but four were not pertinent to the information that I'm looking at. So the last four that we ended up picking up were two articles that look at modern day training for the military, and then two looking at they're basically memoirs from one book is the two Vietnam medics, and the other one is a World War II medic in the Pacific Theater. So the two that are dealing with training, they're talking about the fact that you got the one of them mentions the whole golden hour. Golden hour is the golden standard that for treating medical patients and trauma injury. You want to get the patient from point of injury to a higher level of care, whether it be an ER, OR, preferably. You need to get them there within an hour, and you need to actually have them prepped and going into the OR within an hour. That is the golden rule. They're pointing out that in the new scenarios of combat that they're looking at, they're not going to make the golden hour. They are just not going to be able to do it. The other article points out that they're saying that casualties could actually be on the field up to 72 hours. This is really, really, really dangerous. But they are wanting to get the medics trained up to a point that they can actually sustain these patients out in the field for 72 hours in an unstable environment. And this is a training that they're pushing for these medics to actually learn to be able to accomplish out in the combat field. Be interesting. It's very interesting looking at and what they're proposing. Um, the other thing that the other two, of course, as I said, is more what we're really looking at. Always looking at the training, though. Training is one of the biggest things that I always point out in all of this. So the other two that we're looking at the two conscientious objectors from Vietnam, and this is what they kind of focus on. They're focusing on conscientious objectors and being medics, and they point, they do talk about DOS, but they also talk about other conscientious objectors that they met while they were in training and going through becoming medics in the Army during Vietnam. Do cover some of the horrors of the war and all of this. They also cover some of the training, but this is stuff that is very interesting, useful information on the fact that you're seeing into their lives. You're seeing into what they had to deal with, what was out there. And it comes back to all these things that we need to learn about them. The other one is looking at a World War II medic in the Pacific Theater. He's talking about all the troubles and horrors of what he's seen in the Pacific, and also having to deal with all the different diseases. This is one of the things that nobody really talks about so much, is the fact that there is so much attempts to control disease and everything. And this is also where we have to see the introduction of penicillin. Penicillin is considered the magic bullet. And this is one of the things that comes up in his discussion. He actually uses it in his title. But this is something that this is all these stories that I've actually pulled together for this.